Assalamu alaikum, this is Jahangir and you are watching Medical and Nursing Lectures. Dear learners, today we are going to start Computer Assisted Test number 1 for the Fundamental of Nursing. So the question number 1 is, the systematic and problem solving approach towards providing individualized nursing care is known as. The first option is nursing process, second option is nursing assessment, the third option is the nursing diagnosis, and the last option is nursing practice act. So the correct option is nursing process. Question number 2. The planning step of the nursing process include option A, assessing and diagnosis, evaluating goals achievement, performance nursing actions and documenting them. The last option is setting goals and selecting interventions. So as you know that in the planning step we set our goals and select intervention. So the last option is the correct option. Question number 3. Perform to identify a life-threatening problem like choking, stay-bone, heart attack. So what kind of assessment you will do? Option A is initial assessment, option B is emergency assessment, option C focus assessment, the last option is none of the above. So in these kind of circumstances we do emergency assessment, so the option B is the correct one. Question number 4. What are the three components of nursing diagnosis? Option A, patient etiology, sign and symptoms. Option B, patient problem, sign and symptoms. Option C, problem, etiology, sign and symptoms. Option D, physical assessment, etiology, sign and symptoms. So here option C is the correct option, because as we have studied that in a nursing diagnosis there are three components. The first one is the problem statement, the second one is etiology, and the third one is sign and symptoms. So the option C is the correct option. Question number 5. In this step of the nursing process you prioritize the diagnosis in order to importance and figure out what nursing interventions need to take place to accomplish these as well as goals to achieve your care plan. Option A is planning, option B is diagnosis, option C is intervention, and the last option is evaluation. So in the planning step we prioritize the diagnosis in order to importance and figure out what nursing interventions need to take place to accomplish these as well as goals to achieve your care plan. So the option A is the correct one. Question number 6. Early assessment of the client input and output chart is the example of. Option A is initial assessment, option B is focus or ongoing assessment, option C is emergency assessment, and option D is time-lapsed assessment. So here the correct option is the option B, focus or ongoing assessment, because by the early assessment we mean the ongoing assessment, that we have a patient and every hourly we are going to assess the patient, to assess the input and output of the patient. So here the correct option is the second option. Question number 7. The act of double checking or verifying data to confirm that it is accurate and factual. Option A, collection of data, option B, validating data, C, subjective data, and the last one is objective data. So by verifying data mean validating data. So here the correct option is validating data. Question number 8. Dash is a clinical judgment about individual, family, or community response to actual and potential health problems or life processes. So as we have studied that Nanda defined that the nursing diagnosis is a clinical judgment about individual, family or community response to actual or potential health problems or life processes. So here option A is the correct one. Question number 9. This association was established to develop, refine and promote taxonomy of nursing diagnostic terminology used by nurses. A. North American Nursing Diagnosis International. B. Pakistan Nurses Federation. C. American Nurses Association. And the last option is Ethical Nursing Association. So here option A is the correct one. Association for making and formulating nursing diagnosis is called North American Nursing Diagnosis International. Question number 10. Assessment that focuses on past medical history, family history, the reason for admission, current medications, previous hospitalization, surgeries, psychological assessment, nutrition, complete physical assessment. Option A is initial assessment, B. physical assessment, C. focus assessment, and the last option is emergency assessment. So when a patient come to you, so you ask him a complete history like past medical history, family history, the reason for admission, current medications, previous hospitalizations, surgeries, psychological assessment, nutrition, complete physical assessment. So here the option A, the initial assessment, is the correct option. Question number 11. Which of the following is the component in which you find cluster of signs and symptoms? Problem statement, etiology, defining characteristics, all of the above. So here option C is the correct one. Thank you for watching. For more quizzes, lectures related to medical and nursing, please subscribe our channel.